When anyone learns that they have cancer, the news can be devastating. Learning what your options are can make the difference, sometimes between life and death. But there is one cancer treatment like no other facility in the country that's giving patients new hope with a cancer diagnosis. Dr. John Kresl of Phoenix CyberKnife is here to tell us all about it. Welcome back to Sonoran Living Live, Dr. Kresl.
Thank you.
Well, now listen, I have visited your facility. I know how amazing it is, but tell our viewers at home, really, what is CyberKnife?
Well, Phoenix CyberKnife and Radiation Oncology Center is a center of excellence for radiosurgery. It's a bit different than standard radiation therapy, where it's much more accurate, very precise. We're getting a surgical response without cutting or anesthesia, and offering that to patients who are appropriate for it. So it is a different type of radiation therapy.
And what type of patients are appropriate for it?
Well, it's a very broad category. Pretty much anybody with cancer may be eligible, but we treat a lot of patients with brain tumors, lung cancers, pancreas cancers, prostate cancer, breast cancer. So it's very a very important tool to be considered for pretty much every cancer patient.
It's really the technology, Dr. Kresl, would you not agree with me, that makes you stand out above everyone else?
Yep, combination of technology. We've got the two most advanced and newest radiosurgery devices in the state, as well as a very important staff. We've got a lot of experience that are all accredited and certified for radiosurgery.
Tell us what we're seeing here. This is the actual treatment room here.
So that's the treatment room, and that's the CyberKnife with a patient under treatment. You can see that this is different from most radiation therapy in that the device moves around the patient and moves with the patient, particularly for like a lung cancer that's moving with respiration. The treatment is on the end of a robotic arm that we can now move in concert with the patient's movement, so we keep that precision of targeting just the tumor and not any of the real normal surrounding tissues.
And as you mentioned earlier, non-invasive. I mean, the patient is awake and breathing.
Yep.
And on their own. I mean, just enjoying, just relaxing for a moment, feeling nothing.
No anesthesia. Nothing touches them. They don't feel anything. They don't see anything. Treatments usually last, 30, 45 minutes. We commonly treat patients in the morning, like for brain tumors. They go golfing in the afternoon.
Can you imagine? That is unbelievable technology. We have more information about CyberKnife. We're going to get to that in just a second, but I really hope that you stay with us because you brought along a patient with you that you've been treating. His name is Joseph, and I've been learning about his story, and you will be fascinated as to what CyberKnife has done for Joe, and he's going to join us in just a minute. And you're going to stick around, right, Dr.
Absolutely.
Kresl? Excellent. All right. Here is more information. Phoenix CyberKnife and Radiation Oncology Center. You can email your questions to them at info@pcroc.com. They are located in basically, would that be Phoenix or Scottsdale on Shea? It's technically Phoenix. It's 4611 East Shea Boulevard, a beautiful facility there, 602-441-3845. Their website, which has a lot of information, is phoenixcyberknifecenter.com.